So when we look at rural and remote people, the data tells us that nearly 30% of all Australian population lives in rural and remote populations, and I think that's more like 26% rurally and the other 2 to 4% remotely. Life expectancy will decrease sort of in a linear fashion the more rural and remotely you become, all right? Up to 7 years when you compare it to people living in metropolitan areas. There's a 3.2 times higher rate of disease burden, preventable causes of mortality, coronary heart disease, heart attack, etc., and suicides are all 2 times higher or more. And interestingly enough, there's a 24 times higher rate of domestic violence for people that live in rural and remote areas. So how are our determinants looking for rural and remote people? Well, the big one is obviously going to be environmental. Living remotely is going to decrease your access to healthcare, your education, employment opportunities, etc. Socioeconomically, because you have lower levels of education or lower levels of employment opportunities, you're therefore going to generate lower income. That lower income can put stress into the household, which therefore could relate to the 24 times higher rate of domestic violence. But socioculturally, people who live rurally remotely have a much higher usage of substance and alcohol use, and they use these substances for coping mechanisms because of that stress. And overall, all of these things are going to increase rates of mortality or morbidity across the board. So what are the causes that underpin these inequities? So the tyranny of distance is the big one, okay? The lack of access to get help stops people from getting help. There is infrastructure shortfalls, which bakes straight into that one. If they had services there ready and available, people were more likely to attend them, but they cost money and the government can't spend money on smaller populations as easily as it can in metropolitan areas. Socioeconomically disadvantaged because of their distance, we already spoke about lower income, employment, education, etc. All of these are going to lead to higher rates. So what can be done to address these inequities? So first of all, workforce incentives, okay? Incentivizing people who work in the health industry or the education industry or both to actually go and move rurally and remotely to help those communities, all right? Incentives can be done through offering housing, increased pay, etc. The expansion of the telehealth service is another one. If we had dedicated 24/7 telehealth services for rural and remote people, then it would be easier for them to access the care and help they need without having to travel anywhere. The improvement of mobile services and the amount of mobile services we offer in Australia could be done as well. So instead of a remote clinic only visiting a rural town once a month, that remote clinic could visit once a week. And finally, expansion of tailored mental health services for the issues that rural and remote people experience, right, such as substance abuse, etc., such as the Outback Futures program, which is excellent. And that was your too long didn't study version for rural and remote populations.